Dr. Muhlestein, welcome. Thank you for joining us today.
Oh, thank you very much.
Tell us a little bit about what you're looking to see at the American College of Cardiology scientific session.
I'm very excited about these upcoming sessions, partly because it's the first time it's in Washington, D.C., so we get to go to a different city, which is exciting. And also, there's a lot of different exciting research that's going to be presented there. Some of it's our own. We have 8 presentations of our own that I'm excited to participate in. But one of the studies that I'm very excited about that will be presented as a late-breaking clinical trial is the FOURIER Trial. So this is the first large outcomes trial testing a whole new class of drugs for cholesterol lowering, which is the PCSK9 inhibitor drugs. Now, we've already known they're very effective at lowering cholesterol and they don't cause the side effects that statins cause. But we didn't know whether or not that cholesterol lowering would actually translate into adverse events. And we don't know for sure yet, but we'll find out at that study. What we do know, however, is that the company, Amgen, that sponsored the study and has the drug, which is called Evolocumab, they already, because of business rules, had to make a presentation and announce to the world that the primary endpoint is positive. So what we know is it worked. What we don't know is how well did it work, in exactly what way did it work. And so we're very excited because we know that it worked, but now we want to know all the details about it. And so that's the FOURIER trial that I'm very excited to watch and see.
What's the significance of that finding, though, the positive finding for this trial?
From other research that we've done at our institution and throughout the world, even though we have statins and we know that they are tremendously effective in reducing risk of heart attack and stroke and death in patients who have coronary artery disease, which is the most common cause of death in the Western world, not everybody can take it. It doesn't work effectively in everybody. And so there is a huge remaining treatment gap. This new class of drugs, of which there are several, of which Evolocumab is the one that was tested first, can lower your cholesterol by another 60% without causing any additional side effects that we know of. And so the hypothesis is that it can dramatically help us to reduce the chances of heart attack. Now in the future, we'll have to test for tests and everything, and the price will have to go down. But I can imagine that this can be so game-changing that it can, if we start giving it early enough before people ever get heart disease, and if it continues to be safe, it may eliminate coronary atherosclerosis from the face of the universe.
So the significance is huge, very exciting. So we'll be at the scientific session to kind of see what the results will be and the impact and how they achieve the results. From a population standpoint, though, how many people can be affected by this?
Well, right now, because it's so expensive, insurance companies are limiting it to the most highest risk patients. But now once we find out how good it is, maybe the insurance companies might say, well, you know, we're going to save money by preventing events that we'd have to pay for anyway, and it might become more available. It has the potential to have an impact on the lives of half of America.
Wow. Wow, very exciting. Well, we look forward to seeing the trial results, and we look forward to seeing you in Washington, D.C. at the American College of Cardiology scientific session.
Thank you very much, and thank you all.
Thanks.